Welcome to Brain Wellness, the podcast. I'm your host, Mandy NP. Each episode will bring you a new topic or interview related to brain health and wellness as part of my mission to help you on the path to a healthier, happier brain. So, let's get started. Hello, everyone, and welcome back to Brain Wellness, the podcast. On my episode here today, our episode is, we have LeNae and Trip Goolsby MD. They are the founders of Infinite Health Integrative Medicine Center, a precision medicine practice with a niche focus in health optimization, age reversal, and regenerative medicine. LeNae and Dr. Goolsby are also best-selling authors and speakers. They have been featured experts in various internationally recognized podcasts and magazine publications such as Brainz Magazine, mindbodygreen.com, psychcentral.com, entrepreneur.com, and many others. LeNae and Dr. Goolsby have also published several books, including Think and Live Longer, which is also their proprietary mind-body connection coaching program. Think and Live Longer, in connection with their progressive peer-reviewed and evidence-based medical modalities, is instrumental in helping thousands of women and men transform not just their health, but also their lives. Welcome, LeNae and Dr. Goolsby.
Thank you so much for having us. So excited.
Yeah.
Absolutely. Thanks for being here. So first of all, I always like to ask people, what's your story? Why does brain health and kind of integrative medicine interest you?
Good question. I mean, well, for us, everything begins in the mind and the brain. So why don't you take that one?
Okay. So statistically, depending on who you're reading, I think our health actually, as we are the creators of our lifetimes, basically our health is created by our thinking processes and how we respond to the information that we receive during our lifetimes. And it's really kind of neat to find over the last 5 or 10 years how more and more organizations are recognizing that. And even the CDC, I think their quote was only 7% of our health really originates solely from our genome, and so the rest of it is basically acquired by our lifetime activities, how we eat, and all of these things, and how we respond to, again, those challenges that we receive during our life. So basically how we respond is how we're going to internally create physiologic changes that impact our health. And so that's kind of, that overall picture is the fundamental foundation of how we proceed with our patients and get them to recognize that they are the creators of their outcomes. And then to take it down to the basic thought that the quality of our thinking determines the quality of our destiny, our health destiny, or our outcomes. And as they recognize that and they see that, and a lot of people know that intuitively and live like that intuitively, but a lot of people, when you take it out of the intuition and out of the subconscious domain, so to speak, and you bring it to bring it into the conscious realm, and it becomes a tool that you can utilize, it makes enormous impact on how people live their lives, and for the better. We try and obviously guide them for the better. Yeah. So I hope that answered the question.
It did. Also, too, so we were talking a little bit before we hit record that you got into medicine and oncology. What got you into what you're doing now? How did you make that transition?
That was there was a cataclysmic event that necessitated change. I mean, we were in a little town, and competing with hospitals. So we were in private oncology practice. That town had 2 hospitals with employed oncologists, and then MD Anderson was 90 minutes away. And with political changes in the healthcare reimbursement landscape and just issues locally and nationally, it was no longer tenable to be in private practice as an oncologist. I'm sure you're aware, oncology, chemotherapy drugs are expensive. And, you're constantly fighting to get reimbursed so you can acquire a chemotherapy drug and spend at one point we were spending well over $70,000 a week in chemotherapy drugs alone, much less all the other overhead that you have. And then trying to get reimbursed for that was always
if you didn't dot the I or cross the T, the third party payers, very well.
Yeah.
Third-party payers would take every opportunity they could not to reimburse.
So what was happening is we were personally subsidizing care to the detriment of our family.
Yeah.
And while he was willing to do that, I was not. And so there were some tough conversations that had to happen. And but we had two small kids, so guys like him, they were either retiring or joining hospitals. And we had our kids were like 10 and 3, or they were young at the time, and so retiring was not an option. And for him, job is a 4-letter word, so he wouldn't take an employed position. And at the time, I was going through kind of a spiritual awakening of my own, and as I'm journeying into a new perspective of life and what it all means and my role in this world, he kind of came along for that journey. And I don't know, it was very evolutionary and kind of a slow thing, but I was like, okay, we're going to baby step out of cancer care and we're going to baby step into integrative medicine. So it was a very deliberate kind of shift that we made.
And let me just throw in, this was after she gave me the ultimatum that if I paid somebody else's chemotherapy, she was going to divorce me.
I mean, it got rough.
There is that.
Your debt, it got rough. So that was the transition. And then it took about a year to, get, the day that the chemo chairs, I sold those to a community hospital. And the day those chairs are gone, I was like, there's no turning back. We're all in it now. And that was in 2013. And I think, the only regret we have is not transitioning sooner.
Quite frankly. I think the benefits I see in the upshoot of the things that I do now with my patients, the outcomes are so good, and the preventive aspect of what I do on oncology, for example, it's enormous, obviously. So it's very gratifying to see happy patients coming in and being grateful and thriving, as opposed to the obvious pitfalls of discussions with oncology patients and that. So, although I love doing it, the transition after I really got settled into it was amazing.
Yeah. So better home life balance now too?
Yes.
Yeah. Very good to hear.
We survived. He survived.
Very good. Very good. So without spoiling too much, what can you tell me about your Think and Live Longer program?
Yeah, so our core program in the practice is what we call a 4 pillars approach to health optimization. And in those pillars, we're going deep and taking a very comprehensive evaluation and getting somebody to shift, what they're doing with regards to their nutrition, their physical fitness or the lack thereof. And then we're, optimizing the hormones and the metabolics with bioidentical hormone replacement therapy. And then the 4th pillar is what we call our mind-body coaching component. And the Think and Live Longer program, it started out as handouts. As I told you, I was going through that kind of spiritual transition and understanding what we call the laws of the universe. And so we started giving handouts out to our patients and holding them accountable for reading them and making sure they understood them. And so the handouts turned into like a workbook, and then that workbook turned into what we have today is Think and Live Longer, which is a book. It's available for anybody anywhere because it lends itself really well for anybody who's wanting to supplement, wherever they are and whatever they're doing. But it's a 12 module, if you will, kind of program. And sometimes we get a little resistance on patients. They normally don't go to the doctor and the doctor doesn't give them homework. So there's a lot of re-education that has to happen. But what we have found over the past decade is that we get good results when patients are compliant with 3 out of the 4 pillars. But we get transformational results when they really embody and apply that 4th pillar. So it's really exciting, and it's mandatory really for us. We make the team is responsible for reading it, knowing it, and living it. It's the Kool-Aid, the Bible of the practice, really.
Yeah, that's very cool. And kind of thinking of that, so our brain and our mind, thinking. So that's where I focus on, is the whole brain connection. And we've had lots of different interviews on here, just kind of thinking about your mind, your mindset, where you are in your health journey, not just the structural brain types of things that people normally think about when I'm dealing with in the hospital. This is all aspects of it. So that's why I wanted you guys on here to kind of talk about that whole thinking process. So just when you're talking to your patients about thinking better and thinking more healthy, do you practice some of those things yourself?
So can I?
Please.
So I'm going to just toss back to the book here. I mean, we've already mentioned one of the the universal laws that the quality of your thinking determines the quality of your outcomes, right? That's a universal law, because if the quality of your thought process is unfounded and poorly based in fact, then basically what's going to happen is you're going to say, hey, y'all watch this, and you're going to get whatever outcome comes. And if you're to be successful in your outcome, you also have to have an image of what your result is. Okay, so if you understand that you can have, within the confines of natural law, you can have the outcomes that you're willing and capable of participating in and achieving, then they're yours. So it only takes the thinking process subsequently to actually focus on that end result and have the quality of the thinking and be mindful of that thinking that drives you successively into the outcome, because it's all information. And the information that we receive tells us if we're getting closer, further, or taking a sidestep to the outcome that we're trying to achieve. And so understanding that and using that information as our guide, the input from that information as our guide, same thing happens in health. We try a dietary process, or we initiate an exercise program, and we see ourselves achieving and getting closer to that successful image that we've established. Then each successive step that we get closer, we continue to say, oh, I'm still on the path. Oops, I've gone backwards here. What happened there? So you analyze, you become mindful of the difference, and then you take a new step. And basically that process, when people understand that the quality of their thinking determines the quality of their outcome, I mean, it's a game changer.
So the question was, do you practice?
Oh,
thinking?
Absolutely. For like what we're doing, we also have our own, each, like, the New Year's resolution thing, have that image of where we want to go and what we want to achieve. And then we start doing that, and we'll see what happens over the course of the year. Absolutely.
Sorry to throw that wrench in there. Yeah, I always like to ask, because when we think of Western medicine, we don't do a lot of practice what we preach type of things.
Oh my gosh, no, because you will go by hospitals and see healthcare workers outside smoking. Or they're morbidly obese. It's it's shocking, really. I would say we do, sometimes we do backslide, but it's nice that sometimes we each need to be reminded of who we are, who we are and how we think. Because sometimes when you run into a situation that is not preferred, whether it's a confrontation with a patient or a crazy patient, because Lord, they're out there. it's easy to want to react. And when you're in reactive mode, you're not in a mindful, constructive mode. So
it's emotionally controlled.
Yeah,
absolutely.
So, you know, you have to, even to this day, sometimes I'm like, rare. And then I'm like, okay, I gotta stop that. I gotta, it's not who I am. I gotta fix this attitude.
Well, and that all falls, we have exercises in the book that, you know, when you recognize, and that's chapter 3, the quality of your mindfulness is quite frankly determines the quality of your thinking. So if you're mindful of how you're thinking, then you can understand that, well, you know, am I making this assessment and judgment and thought based on my emotions? And if you're caught up in an emotional response to something, you're not being thoughtful and mindful about it. So the two don't intersect in the Venn diagram. So basically, we have an exercise in there that will allow people to say, oops, I'm doing it again. I'm getting caught up in my emotion. I need to step back, take perspective, and, you know, be grateful for what I've achieved already. And then boom, be more thoughtful about the outcome that we're going to have.
Yeah. That goes a long way in people's health. Even in my typical hospital job, I have lots of conversations with patients about how they need to be careful of how they're thinking, because they will ask me how soon they should get better. And in the neurological world, it's always difficult to say how soon people will get better or if they will get better. But I always talk to people about how the more positive thinking you can do, the better your outcome will be. Because I've had several patients who have gotten just into that negative spiral, and they don't see that anything can help. So they don't go along with the positive attitude with the treatment. And they're just doing it because they think they have to do it, but they're not expecting anything good to come from it. And what you expect, you will find. Yeah.
Right.
You know, so and that goes so well. I made mention of it with my oncology patients. You know, you would have them very often. You know, internal medicine doctors, primary care doctors, surgeons are maybe not as aware of the advances that were in oncology and what the potential outcomes could be, or resolutions. And they would, oh, you got cancer, you're going to die. And I would see people that would be told that by their primary care doctor or surgeon or something, and they would immediately follow that path, and they couldn't let go of it. I've had cancer, I'm going to die. You know, so that mindset drove them much more rapidly to an adverse outcome, because that's what they were looking for.
Absolutely. Tell me about the age reversal. Is that kind of just along with that thinking process too, or what are you doing with that?
So the age reversal kind of comes along as a much more complicated, multifactorial kind of approach that we're now starting to see good data come out in small clinical trials, because they're not large clinical trials, because they don't have pharmaceutical money behind them in the vast majority of cases. So what we're seeing is actually not only pharmaceutical approaches, but the effects of optimization programs like we do, and it's measurable now. So we can actually measure. Used to be everybody thought that the telomere length was the thing to follow, but now we actually have based on artificial intelligence algorithms that were developed by some very bright people, based on some genetic testing of the DNA. The epigenetic changes of the DNA can actually help us define if we're biologically a similar age to our chronological age. And chronological age you can't do anything about, obviously, but biological age you can. And using programs that have had some vetting and some effect on age reversal, and there are multiple different pathways. I can't go into that.
Right.
But those pathways can be addressed so that we can actually see reversal. And I've actually had some amazing success stories with some of my patients that have done the program, done the mind body, and gotten almost 20 years documented biologically, 20 years younger. So really wonderful stuff and a lot of stress response in there, a lot of aspects of that that change the body's physiology. But we're in a domain now where we can actually look at that biological age or genetic, and even though you may have genomic predispositions for certain types of outcomes, as long as you're not tickling that gene the wrong way, you're golden, right?
That's very cool.
Don't live like your parents.
Yeah, exactly. Yeah, if we lived like our parents, we probably wouldn't do so hot, honestly. But yeah, that's very, very cool stuff. Everybody's looking for the fountain of youth all the time, and it sounds like you guys have kind of found it. So that's
well, it does require the patient to show up for themselves. Like, they have to do the work. We do have the tools, but there is no pill. The patient is the pill. And I think we still live in a healthcare arena where patients want to abuse themselves and eat whatever and do whatever, and then go to the doctor and expect that doctor to fix them with a pharmaceutical. And that's very frustrating because they have the power, but they have to be willing to do the do.
And that is the current paradigm. And you see that every day, I'm sure. Every day.
Absolutely. Yeah. I don't know how many times I've taken care of patients that just want a pill to take care of what their problem is, because it's so much easier than actually doing any change in their life.
Right.
Yeah. So
that's chapter 6, by the way.
I love that you have it all right off. So what are some things that you guys do, just kind of side note, just on your own, to stay healthy, physically and mentally?
Yeah, I mean, we work, I'm sure, like you, all the time. I feel like we work all the time. So putting boundaries in place, not working after 11 or on at least one day a week. And that's a deliberate choice, because when you're self-employed, when you have patients, it's always on your brain. So putting in those boundaries, nutritionally, we sometimes fall back, but ideally, we try to do what we preach and eat whole foods, low carb, because right now we're trying to lose that holiday weight. Exercise, I hate exercising. I'm really not good at it, but I am trying to walk more. And then, I know that he knows the book better than I. We both wrote it, but he lives it every day because he's coaching on it every day, and I don't have that benefit. But being very thoughtful of where the brain and thought processes are. Yeah, absolutely. We live it. 100%, probably not, but I would say 85 to 90%. We are doing what we preach.
Yeah, that's pretty good. They usually often say like 85-15 or 90-10. That's a pretty good rule to follow. Nobody can be perfect all the time. We're all infallible. It's all good. Do you have a couple tips that you find yourselves giving patients a lot? 1 or 2 things that you feel like you say all the time?
What do you want? What do you want? What do you want? What do you want? Patients come into our office because a problem has driven them there, right? Whatever their malady may be. And so patients are acutely aware of what they don't want, but most of the time they have not conceptualized what their happy end result is, what it looks like, what it feels like, what they would be doing that they're unable to do now. And even patients that have been with us for a while, they get distracted and they forget, or they're not seeing the results they think they should see, or whatever it is, or some new stressor has come up in their life. And, oh, there's a firefly. Look at that. So we're constantly going back to, what do you want? It's your party. It's your party. What do you want? And so that's definitely one thing that we say all the time. And we kind of have 3 questions. It's, what do you want? Why do you want it? And what are you willing to give or give up in order to receive it? So I think those 3 questions are ad nauseum.
And that's the first question I ask when I walk into the room with a new patient. I said, how can I help? Basically, what do you want? So, and then we go through the initial interview and examination, all that. But during that time, I discuss with them creating that image of what they desire, their desired outcome is in the next year or 2. And, I have very complicated multi-end organ disease patients that come in for stem cell type treatments and musculoskeletal determinations and those types of things that within 6 months I'll have people that come in wheelchairs, ambulating and doing vigorous exercise, much more vigorous exercise to get better outcomes. So like I said, the changes I appreciate doing this type of work. I know that I'm making a huge impact on longevity and health span, and that is just and the patients really, really appreciate the outcomes particularly if they stick with it.
So what would you say, other than what do you want? Are you a broken record on?
Yeah, I think not getting caught up in in worry and fret about what the outcomes are going to be. I mean, you only establish the happy end result, and as long as you're working towards that end result, the information you receive, you have to de-sentimentalize the information that you receive so that it's not creating stress responses. And no matter how we receive the information, we have to allow that the outcome may be better, actually getting a different outcome than we would anticipate. So you look for those opportunities to say, well, what am I learning from this? What is this information telling me? Is it telling me, it may not be the best outcome right in that moment, but looking at where we want to go at the end of the day, maybe it's giving us that opportunity to say, oh, this is what I need to do, instead of continue on that same line of thought. And I think that's one of the things. As long as you're not trying to push the issue and button your head against the wall and saying, well, this should work, you have to stand back and say, well, why is it not working? And this is telling me something. Let me try something else, because the brain is a hugely imaginative field. And and as long as we're open to receiving that information from the field of pure potentiality, which is a physics concept, but the field of pure potentiality actually has everything we know and everything we don't know. And so maybe all of a sudden that inspired thought or that that resistance to your progress in one direction is that opportunity to find the pathway that's really going to make the big difference. And I think that's what, I encourage my patients to think about it a different way, because if they become stressed, they're creating an adverse environment. If they are in allowance, which is chapter 9, then they actually are allowing that, and there's, many different ways of saying it, but you allow that there's something even better out there than what you can possibly imagine in your mind. Because we don't know everything. That's our ego talking to us all the time.
Yeah. Yep. Yeah. So, yeah. Very good. That stress thing is huge. I can't stress it enough with my patients in the hospital too. Just how much stress affects our body, and good stress and bad stress. We often don't think about that, but it also causes the same kind of changes in your bodies. And we have to be cautious of either one of those. But when we stress about what we're doing for our health, sometimes that causes more problems than it's worth. So I love that you're tackling that.
Why isn't it happening? That's stress.
Yeah. Yep. Mm-hmm. Absolutely. So how long do you typically work with patients? Do you set up almost like a primary care, or do you work with them for a certain length of time?
So it kind of depends on the goals of the patients and their budget, because a lot of what we do is insurance does not cover. Generally, most of our patients that come new, we have them coming twice a month, because there's a lot of inspirational and accountability that's held, into what we do. especially if they're like married and they're with a partner or a mate that's not on their program, you know, having someone to go to that's going to keep you aligned is very important. People who are on BHRT, to keep those levels optimal, that's a lifetime, you know, you're signing up for life to do that. So it really depends on, you know, what the patient wants.
Fair. So with the stem cells, you mentioned that for a brief moment. So that's your regenerative medicine part of your practice, correct? Yeah. I have done a bit of that myself the last couple of years. So every other Friday, I go down with the chiropractor that I work with. One of my best friends, he's turned out to be, and we do regenerative medicine also. And I've seen some just amazing things that have come out of that. When you actually mentioned, Dr. Goolsby, about how sometimes we see benefits that we didn't expect, that's where we see a lot of that with the stem cell regenerative medicine. Do you want to expand on that a little bit more? Or
you know, I kind of got into it about 7-8 years ago, almost just briefly after the transition, and it was mostly with the musculoskeletal stuff, it was prolotherapy and not even using the stem cell or the mesenchymal signaling cells that are better said, obviously, but using dextrose injections and those things to create repair of osteoarthritic, arthritic, and different joint musculoskeletal problems. And then that immediately led into research and that on the mesenchymal signaling cells, the exosomes, and extracellular vesicles and all that. And as I've advanced in that, I've developed programs for virtually all of the end organ diseases and common degenerative diseases. I've treated stroke patients and that with success and recuperation. I mean, it's been an amazing journey that. And I know that, there's the research in that area is kind of stymied because it's biologics that can't be patented by the pharmaceutical industry. But I know that they are actively working on ways of modifying those things so that they can maybe be more effective. But in those cases, it's very much like some of the colony stimulating factors when I was in oncology. They would never do comparative trials to other things because that wasn't in their best interest. So financially, and I understand that, it's that's their domain. But some of this information that is coming out now with the laboratory research and then some of the small clinical efforts by a number of people in the domain, I think that information is slowly but surely accumulating, and we're having positive results. So it's not unlike the prolotherapy. I just hope it doesn't take a century to be accepted as a more reimbursable care method, because now it's very expensive, obviously, to do those things. I actually have an age reversal program that I'm also participating in myself, that using intermittent infusions of body weight adjusted exosomes and that, which is combined with obviously all of the other pathways. But I'm just waiting to start getting the data on the biological aging on those individuals. So really exciting stuff.
Yeah. And before we hit record, we were talking about how things are changing all the time. That's one of those areas that's constantly changing because we're finding out new uses and new benefits, and it's exciting stuff. It's a whole lot different than the type of medicine that you were doing before. And it's if it's anything like how I feel when I do those days, they're so rewarding. So
what are you doing in the hospital?
I know.
Is it to remind yourself?
When I leave the hospital days, it's when I really remind myself, oh yeah, this is why I do the healthy things that I do, so that I don't have those same outcomes. So Yeah, very good. Well, I do want to be respectful of your time. Is there anything else you guys wanted to add? We could probably go on all day long and I could ask you a ton of questions, but
For sure. We'll just have to come back again
yeah.
another time. Anything else you want to say?
No, I think that's this has been great. I mean, I think you're obviously, bridging the gap there, and and I just have to say I can empathize. I spent a year at the Mayo Clinic there in Rochester, so I understand the weather and
yeah, that's a whole nother topic for another day, but the weather is certainly something else here in Minnesota. So I could take some of your New Orleans warmth right now. That would be really nice.
I guess, if anybody just wanted to learn more about what we do and how we do it, they could go to the website at yourinfinitehealth.com. And then if they're interested in the book, Think and Live Longer, it's available on Amazon. They can also call the office. We'll ship one out to them as well.
Awesome. Thanks for that. Thank you guys for being here today. And we might have to do this again sometime because it was a lot of fun.
Cool.
Right.
Well, thank you.
yeah.
Yes.
Thank you.
Have a great day. Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, like, and share this with others to help me continue on with my mission to help people live healthier, happier lives. Go to www.brainwellnesssolutions.com to see what I'm up to and get links to all the social medias there. See you next time.